Hello viewers, this is Dr. Muhammad Iftikhar Aslam presenting my lecture on cat scratch fever, which is also known as bacillary angiomatosis. In today's lecture, we will cover information regarding the organism that causes cat scratch disease and its epidemiology. We will also talk about the history of the disease, how it is transmitted, species that it affects, including humans, and clinical and necropsy signs observed. Finally, we will address prevention and control measures as well as the actions to take if cat scratch disease is suspected. Cat scratch disease is in most cases caused by Bartonella hanseatic, a fastidious pleomorphic gram-negative rod in the family Bartonellaceae. The family, which was once thought to belong to the order Rickettsiales, has been moved from that order. There are two major serotypes of Bartonella hanseatic, type 1 and type 2. Strains variations are thought to exist within these serotypes. Bartonella clarigiae, also found in cats, has been implicated in a case of cat scratch disease in a veterinarian. Bartonella hanseatic is probably transmitted between cats by cat fleas, Tinocephalus felis. Experimental studies have shown that fleas or the intradermal inoculation of flea feces can spread the infection between the cats. Transmission is reduced or absent when fleas are controlled. Bartonella hanseatic has also been isolated from the ticks, but the role of this organism is unknown. Whether Bartonella hanseatic can be spread among the cats by other routes is unknown. Transmission to humans is not completely understood. Cases of cat scratch fever are usually reported in people who have been scratched, bitten, or licked by cats. It is possible that the source of infection is cat claws or teeth contaminated by flea feces. It has also been suggested but not proven that fleas may be able to transmit Bartonella hanseatic directly to the humans. Cats and other felids are thought to be the only reservoir host for Bartonella hanseatic. Organisms have been isolated from the domestic cats, cheetahs, and mountain lions. Antibodies have been found in domestic cats, Florida panthers, mountain lions, bobcats, and cougars. Symptomatic infections have been reported only in some experimentally infected cats. Mice can also be infected under some conditions. Naturally infected bacteremic cats are asymptomatic. Some studies have suggested that Bartonella hanseatic might be pathogenic under some circumstances. Experimental infections have been equivocal. In some experimental infections, all inoculated cats remained asymptomatic. In others, clinical signs such as transient fever, lethargy, anorexia, myalgia, and lymphadenopathy have been reported. Mild transient anemia, eosinophilia, delayed conceptions, and reproductive failures have also been seen. Both type 1 and type 2 Bartonella hanseatic have caused clinical signs. In immunocompetent people, Bartonella hanseatic causes cat scratch disease, a mild to severe self-limiting infection in humans. The initial skin rash seen in 25 to 90% of the patients consists of one or more small erythematous papules, pustules, macules, vesicles, or ulcers at the site of inoculation. Less often, there may be headaches, anorexia, vomiting, nausea, weight loss, splenomegaly, generalized pain, or a sore throat. Cat scratch disease is usually a self limiting infection, and the complications generally resolve without sequelae. Bartonella hanseatic can be isolated from the blood and tissues of the infected cats as well as from the cat fleas. Isolation of Bartonella hanseatic is difficult, and it requires specialized media and has mainly been used in research. The organism takes 9 to 45 days to grow. Serologic assays such as ELISA, polymerase chain reactions, assays, transmission electron microscopy, and confocal microscopy have also been used in research. Preliminary data suggests that tetracycline can be used to treat the asymptomatic Bartonella hanseatic bacteremia in cats. However, it is unknown whether these cats are susceptible to reinfection or recrudescence. Prevention depends on avoiding bites and scratches from cats, particularly kittens. Rough play with kittens should be discouraged, and any bites or scratches should immediately be washed with the soap and water. Allowing the cats to lick the skin, particularly the open wounds, should also be discouraged. Hand washing after the contact with a cat may be helpful. Flea control may also be a preventive measure, but this is not certain. Declawing does not appear to affect the transmission, but keeping the nails clipped is suggested by some sources. Preliminary data suggests antimicrobials may be able to clear the bacteremia in cats. However, it is unknown whether these cats are susceptible to reinfection or recrudescence. The disinfectant susceptibility of Bartonella hanseatic does not seem to have been published. However, the closely related organism Bartonella bacilliformis is susceptible to common disinfectants including 70% ethanol, 1% sodium hypochlorite, and 2% formaldehyde. Well, that's the end of our today's lecture. Thank you so much.